Holistic Wellness Coach. Today we are talking about something that I am experiencing in my life, and so I have to get an iron infusion. So when I went to book this thing, they told me I was going to be there for 6 hours. I was like, what? I didn't even know what this was about. So I'm sharing the information like I usually do and doing research. So if you've been following me, you know that I am severely anemic. I have no iron in my system. Found out like 3 weeks ago when I just went in to see my primary care physician, and my hemoglobin was at 7.1, dangerously low. And so, as I do with everything, I am dealing with it holistically and naturally. So I found an additional supplement that I added in because I've actually had this happen to me twice before. Once when I had ulcers and was bleeding from my stomach. The other was hormone related, and it's hormone related again. So that supplement is Floretics that I'm anemic in, and I'm increasing my Ninja Red, making sure that I have my mineral essence. Hey, thank you, girl. So, but because my hemoglobin was so low, they sent me to hematology, and hematology has decided that I need to get an iron infusion, which I've never done before, and I didn't know what it consisted of. So again, I looked up an article from from a clinic in Cleveland, and it had information. So starting from the very beginning, what is iron? Why are we talking about it? So iron is one of the minerals in the human body. It is one of the components of hemoglobin, the substance of red blood cells that helps blood carry oxygen throughout your body. If you do not have enough iron, your body cannot make hemoglobin, and you may develop anemia. And this is known as iron deficiency anemia, which is the most common type. So factors that can lead to that: blood loss caused by ulcers, some cancers, and other conditions, and in women during monthly periods, which again, this is my third time having it. First it was ulcers, this time is excessive bleeding during my monthly periods. A diet that doesn't have enough iron in it, taking medications that interfere with the ability of the body to absorb iron, and increasing the body's need for iron, for instance, when a woman is pregnant. So what are the signs of anemia? So several signs: feeling tired, paleness, difficulty breathing, fast heartbeat, dizziness, headache, feeling cold, including the sensation that your hands and feet are colder than usual, infections caused by problems with the immune system. So who is most likely to develop iron deficiency anemia? The top one: women, blood loss during monthly periods and childbirth can lead to anemia. People who are over 65, who have iron poor diets, people who are on blood thinners, people who have kidney failure, especially if they're on dialysis, and people, people who have trouble absorbing iron. So who receives intravenous iron supplementation or an iron infusion? Usually you receive it because you cannot take oral iron. In my case, as I mentioned, my hemoglobin is so low and I have so barely any iron in my system. And synthetic iron pills never worked for me. And and I'm doing things naturally. I'm doing it through food-based supplementation, but that's still going to take like 2 to possibly 6 weeks. So the hematologist decided that I should get an iron infusion just to like bump me up right quick. And that would be super helpful. So procedure details. First, they're going to diagnose the anemia through blood tests. So again, I just went to my normal primary care physician, took my normal blood tests, and to my surprise, not even knowing it, severely iron deficient anemia. So how do you treat it? Well, the first and foremost is diet. So I'm so thankful that one of the tools that I have as a holistic wellness coach is the scan that I do for my foods. And so now that I know this and I'm looking at the scan, I can see, oh, it wants me to eat these specific things. And so I'm looking at my food and being like, oh, this has 10% iron. Oh, this has 25% iron. Okay, great. Because I know that's what I need. And making sure I put a lot of that into my diet. Some things that you want in your diet, depending on how you eat: oysters, kidney beans, beef liver, tofu, beef, if you're a meat eater, like chuck roast, lean ground beef, turkey leg, whole wheat bread, tuna, eggs, shrimp, peanut butter, leg of lamb, brown rice, and raisin bran that's enriched. Again, you can also take iron supplements in pill form. Those don't work for me. I don't absorb them very well. You can take erythropoietin stimulating agents. So this helps you to make more red blood cells. And then if you need additional, or you can't absorb it in those ways, that's when you would get an intravenous iron supplementation. So intravenous iron supplementation is a method of delivering iron by infusion with a needle into the vein. So this is called a parenteral therapy, any type of medicine that is given intravenously. So how's intravenous iron given? It is delivered into the patient's vein through a needle. The procedure takes place in a doctor's office or a clinic and may take up to several hours, depending on which treatment the physician has prescribed. The patient usually receives iron injections over the course of several visits until his or her iron levels are correct. So in my case, again, as a holistic wellness coach, I am doing it all natural through food and whole food-based supplements, but we're doing at least one iron infusion just to like bump me up right quick so that I can restore some of that because there was so little iron in my system. And yeah, I was completely shocked when I booked it and they're like, oh, it's going to be 6 hours. I was like, what? 6 hours? So because it's my first time, they have to test it. So they're going to give me a little, wait 30 minutes, then come back and give me the 4 or 5 hour dosage. And then lastly, what are some of the risks and the benefits? So what are the side effects of intravenous iron? The side effects of intravenous iron are usually minimal, but they may include the following: bloating or swelling of face, arms, hands, lower legs, or feet, dizziness, faintness, or lightheadedness when getting up suddenly from a lying or sitting position, gastrointestinal pains, including nausea and cramps, problems with breathing, skin problems, including rash, chest pain, low blood pressure, anaphylaxis, which is a severe reaction that can include difficulty breathing, itching, or rash over the entire body. So how effective is intravenous iron? When you're going to start feeling better, depends on your particular situation. It can take a week to a month after iron supplements. And you just have to continue to watch your symptoms. So I am taking some whole food supplementation plus the iron infusion that I'm going to get next Friday. Should get me back to where I need to be. So, and in the meantime, I also found out that I have to go get so I went back to gynecology for the hormone issue, the fibroids that I'm experiencing. And I have to get a ultrasound, MRI, pelvic, so we can see if it is possibly necessary for me to have another procedure that I had in 2015. So that's where we are with that. But in the meantime, regardless, it will be important for me to increase my iron levels back up to normal and get my hemoglobin back up to normal so that I can feel normal. But it was actually kind of crazy and amazing that I didn't even know that I was anemic. And it was a complete testament to all of the supplements and all of the things that I'm taking because, I shouldn't have been able to get out of bed or barely walk with what my numbers were showing at the time. So that is what I want to share with you. If I have any other people that are on my timeline that happen to be iron deficient anemic and we're thinking about an iron infusion, I didn't know what it was, what it involved exactly. And so I thought I'd research it and share it with you guys because that's what I do with my life. With that, I'm going to close this out. Again, when you come on here, give me a wave, a hi, hello. Let me know what city or state you're watching from. And no matter what venue you are watching, if it's later on Facebook, Instagram, or YouTube, then hashtag replay so that I know that you came by. As usual, if you have any questions, do not hesitate to get back with me. Have an amazing evening, guys. Bye.